watching Let's Chat.
I am here this morning with my friend Dr. Megan Stevens, who is a vascular neurologist from Erlanger Health Systems. Thank you so much for coming on the show, Dr. Stevens.
I'm happy to be here.
Yay.
Thanks for having me.
You bet. So we're raising stroke awareness, and it sounds like there's a really fun event coming up.
That's right. So Strikeout Stroke is an event held annually to raise public awareness for stroke symptoms and also emphasize that early identification and treatment can lead to better outcomes in stroke patients.
Why is it important to know the signs of stroke? Could you talk to me about what you see and why we're raising awareness in the first place?
Absolutely. So knowing the signs of stroke can then lead to patients being treated faster, and time is brain. So we have better outcomes when we can treat stroke patients earlier. So some of the symptoms we can go over. An easy way to remember is B fast, B for balance, E for eyes, F for face, A for arm, S for speech, and T for time to call 911, because again, treatment of stroke is time sensitive.
I see. So if you're suffering from a stroke, it's not necessarily a death sentence.
Absolutely not. Absolutely not. And again, early identification leads to early treatment, which leads to better outcomes. And again, we're trying to raise awareness by having this event, Strikeout Stroke. We're partnering with the Chattanooga Lookouts baseball team, and the game is at 7:15 this Thursday.
Who will be throwing the first pitch?
So to emphasize how stroke is not a death sentence, and in fact you can have really good outcomes, particularly with early intervention, we're having one of the Erlanger stroke patients throw out the first pitch, because you can make enough functional recovery to do things like throw a pitch at a Chattanooga Lookouts game.
I love that. So share with me about functional recovery. What does that mean if someone has suffered a stroke?
So when somebody has a stroke, it does mean that they are at increased risk of having disability or even death. When we are able to intervene early, we reduce the chance that happens. And when we talk about functional recovery, we mean getting back to doing the things you were doing day to day, taking care of yourself, driving, paying the bills, getting out and walking, and having fun doing your hobbies.
So you could have suffered a stroke and that doesn't mean you can't drive. You could drive again?
Absolutely. Many of my patients, that's the first question they ask when they come to clinic to follow up after a stroke is, when can I drive? And so much of that is determined by, did we get early treatment for stroke? And at Erlanger, we have a designation that we are a comprehensive stroke center, which means that all aspects of a patient's stroke care can be handled at Erlanger, no need for transfer. And amongst comprehensive stroke centers, Erlanger has a special designation. We got the Gold Plus Achievement Award through the American Heart Association, Get With The Guidelines, for having a stroke excellence in care. But additionally, we have extremely fast, what we call door to needle times. So when somebody presents to the ER, and they are determined to be a good candidate for clot retrieval, so sucking out the clot that is causing the stroke symptoms, we can really help achieve better outcomes. Some of our times are under 10 minutes.
Right. Could you tell me briefly what is a stroke? I think there's misconceptions.
So stroke is when you have an interruption of blood flow, either because of a clot or you have a blood vessel rupture that then leads to downstream brain death. And so when you have a stroke, it means that you are now incurring permanent brain damage, and we can stop the amount of damage that's being incurred if we have early treatment.
Is it done through surgery?
So it's done through a procedure where you take a catheter through the groin and you can suck out the clot. And we also have medicines like TNK or TPA, which are the clot buster medicines that you can get delivered through your vein.
This must be a fulfilling line of work you're in, to see the success rate of people come in, and maybe talk to me about that.
Absolutely. So patients can come in and have a loss of their language, a loss of the right side of their body, not able to walk, and through early intervention and afterwards getting a lot of therapy, whether that's speech therapy, physical therapy, occupational therapy, they can really get to a point where they're able to maybe not do everything that they could before, but do quite a bit and can be independent.
So the key is what you said, early intervention. Is that the secret?
Absolutely. And that's why we, again, want to raise public awareness for stroke symptoms through this Strikeout Stroke game that will be this Thursday at 7:15.
That's great. Thank you so much for coming on the show and raising awareness about this. And it's wonderful to have you in, and always with Erlanger, all the important work you do in the community. So make sure you go check this out this Saturday. This Thursday, May 18th, 7:15 p.m. The Chattanooga Lookouts is holding the Strikeout Stroke with Erlanger game. First pitch being given by a stroke survivor.
Absolutely.
Thanks for coming on, Dr. Stevens.
Thanks.